Thank you, Representative Lutmeyer. And I think innovation is a key word, especially when we're talking about healthcare reform. So I think that's a key word when you go back to your states and you're talking about healthcare reform. So with that, I'd like to open the floor up for questions. Anyone have questions? We have a microphone that we can get to you as quickly as possible.
I'm just wondering why it is that there is not more, basically there is a suppression of medical evidence to support these, and they are not widely publicized. I think we as legislators should be widely distributing that information if we are to clearly address the issue of women's health.
Yeah, was there a question? Was it? Okay. Oh. That's what I was going to ask, if there was a question. Okay.
Well, we have these experts here. This is a question about the 11-year-old girls receiving that immunization shot for sexual cancer later on. I mean, what about the safety factors? I've heard pros and cons about that, the series of shots being given to young girls.
Okay. For the perspective of Gardasil, I think that what we know is that cervical cancer is most closely related to two strains of human papillomavirus, strains 16 and 18. There are 84 strains of it, and most notably, those two are usually contracted through sexual contact. It doesn't have to be intercourse contact. It can be skin-to-skin, genital skin-to-skin contact, which often precedes intercourse in young girls. In terms of the immunization side effects, we don't have any reason to believe that the side effects of the Gardasil are more prominent or occur more often than in side effects of other vaccinations that are given. It's actually not, when you look at it, it's actually less than the childhood immunization side effects. So I think that probably the media is responsible for a little bit of dramatization, but the truth is when you see a 16-year-old with cervical cancer, or you see my niece was 18 when she had cervical cancer and because of some inappropriate behavior in college. I will admit that she was inappropriately sexual without protection. She had cervical cancer at age 18. For that story and for all the other stories that we see of young women, even women who are tragically raped or assaulted, the Gardasil vaccine really saves them, saves their cervix, saves their fertility. And, personally, I believe it's a very, very wonderful vaccine, and I'm excited that it's been approved for young boys as well.
I'd like to just say a little bit about what has happened over the last 15 years with young women. The HPV virus is so lethal. 16 and 18 will cause a rapid change in the body. It used to be a time when cancer took a long time to get to the point where it would be called cancer. You can have atypical cells today and in 6 months have a high-grade lesion that's borderline cancer or even a cancer. That was unheard of when I first started in the field of cytology. It just didn't exist. The worst thing that you could see would be herpes or some other vaginal infection, but you didn't see widespread high-grade lesions in very, very young women. For that reason, I have a 24-year-old daughter. When she asked me about taking the vaccine, I encouraged her to take it. I would much rather for her to be protected when she is ready to be sexually active than to just look in the sky and say, oh, well, it's not going to happen to me. It does happen. And women are becoming victims of this denial. And that if we're going to improve our health, we have to take ownership of our health, of our actions, and be accountable for those things so that we can live a long and fruitful life.
I think one more point in that HPV doesn't affect just the bad girls. I mean, the truth is that about up to 80% of sexually active adults in the United States carry the HPV virus. It's ubiquitous. So we really need to help these young women because they have a special zone in their cervix called the transformation zone that is very, very, very fruitful ground for the HPV virus to invade and start to replicate and become precancerous. So, yeah, I would agree with you completely.
Can we also talk about, I think, one of the hidden agendas is why an 11-year-old? And so what you shouldn't be doing is equating the age at which she gets the vaccine as to what the expectation is of when she's going to be sexual. They are not at all linked. It's about getting people vaccinated early on so that when they're adults and they're making choices or not making choices, it's not an issue. So it's about getting vaccinations when you go to your pediatrician, when health care is available, and when the vaccine is available, and getting them immunized. It's not about whether or not you're teaching them anything about sexuality.
I have 2 comments and a question. The discussion today has really made me believe that we need to do a better job training our medical community as they emerge out into it. And the discussion and confusion about when we should have mammograms and when not has really solidified my belief that those decisions should be between me and my doctor and not everybody else. So I have a question for our gentleman participant. What types of incentives can government provide to the innovative companies that would encourage and promote the innovation without becoming the marketing-driven, government being the market driver?
Well, I think you're seeing that in the healthcare debate right now in Congress. And just as a side, and I don't mean to dodge the question even though we are in Washington, but most of innovation in healthcare occurred in Europe 30 years ago. And when government established price controls and different barriers to the market, those innovative companies moved to the United States. Now, as Congress debates those incentives and encourages, we hope, innovation, and we hope that they don't take that innovation away, that research and those outstanding jobs and the innovation of healthcare can leave the United States and go to countries that we may not want them in. So as Congress debates these things, and we can talk about reimportation, and we can talk, which is very unsafe, and we can talk about government negotiated pricing, which takes away opportunities for a free market and disencourages innovation and research and development. As Congress debates those things, they should be very careful that these industries, this industry is a global industry that can move to places that are more beneficial. Well, and I think all innovation. So, well, being the honored gentleman to be up here with this esteemed panel, if there are no other questions, thank you very much, and thank you for attending.
Thank you.